Hello and warm welcome to MedSynapse podcast series where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host Dr. Smarika Bhatt, and today we are tackling into the one most fearless phase of medicine, that is stage 4 cancer. To join us with the conversation with us, we have today Dr. Arun Mitra with us. He's a leading surgical oncologist at MIOT International Hospital, Chennai. He's an expert in minimally invasive and robotic surgeries with a special focus on early diagnosis and right treatment for cancer. Welcome, Dr. Mitra, to the podcast. We're excited to have you here.
Thank you, Dr. Smarika. Thanks for the invite.
Pleasure is all ours. So without further ado, we'll start with our first question is, many people hear stage 4 cancer and immediately think that, oh, it's over for us, that this is the end. So is it actual, we see stage 4 cancer as a death sentence today?
See, cancer is not always a death sentence. It is understandable to feel apprehensive while dealing with the cancer and the diagnosis of the cancer. But when it's perceived as a death sentence, people may avoid seeking healthcare facilities, and this is complete misrepresentation of the illness. For example, cancer is a non-communicable disease like diabetes and hypertension. So we don't see people associating diabetes and hypertension with death sentence. In fact, the patients will consult the respective specialists for diabetes or hypertension. They take appropriate treatment and they live with it. Now, cancer is also the same. When somebody is diagnosed with cancer, they confront it, they seek the healthcare services at right time, they take treatment for it, and they live with it. So, if it is seen as a death sentence, and if we propagate this idea that, or if we represent it as death sentence, it is misrepresented, and the fear of cancer is more than the cancer itself.
So that was very powerful statement you have given, and I'm sure our audience will have little insight regarding it in the further conversation. So we'll move on to our second question is, there is a belief that once you hit stage 4, so conventional treatments like chemo or surgeries won't work. So is that true, or is there any well option on the table?
No, it's false that conventional treatments do work in any stage. Now, staging, we must understand the idea of staging in cancer. The staging in cancer is a uniform way to identify the extent of a disease, communicate among the healthcare professionals, and to plan the treatment and to give prognosis. The higher the stage, the deadlier it is a myth. Now, all the treatment modalities are applicable for even stage 4 cancer. That is surgery, chemotherapy, or further systemic therapies like immunotherapy, targeted therapy, and radiation. All these treatment modalities are applicable in stage 4 cancer as well. For example, the reason why I mentioned about we must understand staging is that not all stage 4s mean the same. For example, a tumor in oral cavity that is extending into the bone, that is also stage 4. Even if it doesn't have disease anywhere else in the body. Now, for this individual, the treatment will still be curative. We will offer surgery to remove the entire tumor. We will reconstruct it so that the patient can eat and talk normally. After the surgery, we will offer radiation with or without chemotherapy. So if you see, this treatment is personalized for that particular individual with a stage 4 cancer. So all stage 4 doesn't mean the same. And another example to it is, for example, if a tumor is in ovary and it has spread to a fluid in the abdomen cavity called ascites, or fluid in the lungs called pleural effusion. So we are dealing with an individual with an ovarian tumor with ascites and pleural effusion. That is fluid in the abdomen and fluid around the lungs. Now, although the tumor has spread from one site, that is ovary, to other sites of the body like abdomen and around the lung, it is called stage 4, yet the treatment is curative and it works effectively. For this individual, we'll offer chemotherapy first. We will downsize and downstage the tumor and later take the patient for a curative surgery, followed by maintenance chemotherapy or targeted therapy. So with these two examples, I want to reinforce the fact that all stage 4 doesn't mean end. The first example, stage 4, that is locally advanced disease. The second example was an ovarian tumor with spread in the other parts of the body, yet curative treatment is offered and is effective.
So, as you have given the example of localized a tumor and everything, so in our social media, we see a lot of reels or in ads like there are miracle cures, like you can drink this herb or medicine or this energy juice, or the kind of you can go into the healing journey so the cancer will be cured. So, what are your take on this? Should patient be cautioned of it, or are they correct, or how should we go about it like that?
See, internet is full of these miracle cures for cancer, and they are selling hope more than anything. I'm sorry. The vulnerability and the anxiety or the stress or the uncertainty around the diagnosis or the word cancer is causing all this trouble, I believe. Now, some of these patients are also worried about the consequences or the side effects of the treatment or the fear of treatment as such. They get to hear from their relatives or friends that chemotherapy is harmful. If you take chemotherapy, all the side effects will be very dramatic, that you cannot carry out your activities of you cannot recover. So in such circumstances, they tend to avoid medical care and seek such miracle cures or complementary or alternative medicines. Mind you, none of these therapies are supported by scientific evidence, and in fact, in certain scenarios, they may pose more danger than any benefit.
Okay, so that is very important. There are genre you highlighted that marketing things are selling hopes more than anything, but there are something called keeping the positive attitude also beat the cancer, or how much does the mindset in stage 4 matters? So what are your take on that?
So see, there's no scientific evidence that says that being positive or being strong directly impacts the treatment or the survival in cancer, but then it definitely enhances the quality of life of these patients. Now, techniques like meditation and yoga will relieve the stress of the diagnosis and the stress that they undergo during the treatment journey. Most importantly, the support group systems in oncological practice. So these support groups offer a platform for all the individuals with similar illnesses to share their experience or their journey from diagnosis to the treatment. They can sit around, they can discuss their feelings or concerns. They can receive the most important emotional support that they need while going through the journey from the person who is either undergoing therapy or who has undergone the treatment and overcome the disease. So these support groups, in fact, help most of our patients. It is like seeing is believing. So once you see a patient who has overcome the disease positively and is surviving and is leading a normal lifestyle, you will believe that you will be there one day.
Oh.
So all these things help our patients.
Got it. So people imagine stage 4 as being a synonym with constant agony. So is pain and suffering unavoidable, or there are ways to manage them better today now?
See, in today's era, suffering with pain for any reason or because of any diagnosis is criminal. So like I was discussing, so the pain medicines, the side effects of the side effect profile of these pain medicines has completely changed. Now we have extremely good pain medications that are least toxic, yet offer yet serve the purpose. Now there is an entity called Pain and Palliative Care Services. It is an integral part of our oncological service, wherein the palliative services team associate with the clinical oncologists, that is medical, surgical or radiation oncologists. They involve in patient care from the beginning, be it at the level of diagnosis, during the treatment or after the treatment. This palliative services team will liaise with the clinical oncologist and help the patient from the diagnosis to the treatment and after treatment. For example, they support at the time of diagnosis, the breaking the bad news. So not many can cope up or tolerate the news that they have cancer, and when they listen to the word stage, and particularly stage 4, they react, and they may react in any way. So from that level of at the level of diagnosis also, our palliative care services team will pitch in, will try to counsel, will try to make them understand, will try to involve them in the support groups and make them understand the entire process of treatment. And during the treatment, whenever there is a challenge, they will come, they will lend a helping hand, they will counsel the patients and support them. And after treatment as well, this is called cancer survivorship. They will support the patients, they will support our survivors to rehabilitate them with respect to their career or in their personal lives or in the life ahead, that is after being disease free. So this pain and palliative care services is an integral unit of oncologic services. They help us in all these processes, and they don't just talk to patients, they help the families as well. See, the patient, and if there is a cancer patient in the family, the entire family goes through it. So this pain and palliative care team supports the patients as well as their families.
So that was a very lovely insight you have shared, and thank you for busting myths today. I'm sure our audience have gotten a valuable insights from your journey. Thank you so much. Thank you so much for coming today as well.
Thank you.
And thank you to our viewers for tuning in. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers or participate in meaningful discussions and contribute to the ongoing evolution of healthcare. So until next time, stay tuned, take care.